Hey everyone, Dr. Adam Graves here. Christy, a newsletter writer. We're going to be talking about getting back to life. So moving from safe at home to safer at home, what that really means. How's that look for you guys out there? How's that look for me in my practice and my clients? So take it away, Christy. How are we going to navigate this all?
That's my question to you.
Okay.
So we've been
Well,
at home. Well, we've all been at home for almost a month now, at least
yeah,
a month probably.
yeah,
And let's be honest, the thought of getting back to things, as much as we might like the idea, it's scary.
yeah,
Can you talk about first, as this process slowly changes and things open,
sure.
where is it okay to go?
Yep.
Where would you definitely stay away from? Let's start there.
Yeah. So the good news is the data is still looking good. So we're testing more people. We're actually showing that
Do you
a
mean
lot of
Colorado, or do you mean at the US as a whole?
nationwide,
Okay.
nationwide, a lot of more people are symptomatic than or have had it and have no symptoms. So this is very infectious, but as we more people have it and the death rate stays about the same, the fatality rate looks better. And the fatality rate still is high in obese, diabetes, elderly. So if you're in that scary at-risk population, I would still consider stay at home. If you're not in there, and I even talked to Colorado, I talked to the mayor, Douglas County, the hospitals are doing good. So there's plenty of room in there. So as we do get back to life, as the numbers start going up, we have a little bit buffer. So and what that buffer says is it looks like the numbers were at about 80% stay home. We can drop to about 65 to 60% stay at home, and the hospital should be okay to keep up with that.
What does that mean?
About how much of the population?
Right,
So,
but does that mean I can take my kids to the playground,
oh,
or we can go to the pool, or
no,
nope, just still going for a walk around the block?
yeah, I would say not yet. I mean, I would say start to get back to life, try to be creative. You know, it may be going in your car and getting takeout from a restaurant and then go having a picnic at a park where you can safely social distance. You know, I still would avoid crowds. I still would wear a mask if you're around people. I think if you're out alone walking, you don't need a mask. But if you're in the grocery store or going to be around people, you should keep your mask on hand. But I think you should and still do your minimum, but slowly try to get back out and feel a little bit of a normalcy. You know, I wouldn't go to a playground and let my kids play with 100 other kids, but I would definitely go on a walk or a hike and be outdoors a lot more and just, you know, create space between people when you're walking with them.
Okay. One of those ways to get back to normalcy is to frequent businesses such as yours. And there's a lot of us out there that would really like to get an acupuncture appointment, but
Yeah.
are you going to be opening? What are you doing to
Yeah.
make this a safe
Yeah.
experience for everyone? Is it
Yeah.
okay to come in?
So yeah, lots of what we're doing, what we've always done from the beginning of this is lots of extra precautions. So we're asking clients as they book, we're kind of closing down our waiting room. So we want people to park in their back and then come in the back door. And ideally they can call Diane, my office manager, when they're back there, and we'll bring them right into one of the treatment rooms. So they don't have to, we're trying to minimize our interactions as much as possible. So bring them into one treating room. We can treat them. They can wear a mask if they want. I'll probably be wearing a mask. Once talking, I won't wear a mask, but once I get in close for acupuncture or something, I'll put my mask on. And then we're going to have a little bit slower schedule, so that gives extra time for me to bleach and disinfect the rooms in between patients.
Can someone request that you wear a mask the whole time?
Yeah, whatever anybody wants, whatever makes people comfortable. And then also they can, then after their treatment, they can go back out to the car and call Diane, call my front desk, and she can just check them out with their credit card over the phone and rebook them over the phone. If we need any supplements, we can get them to them in the room, but we're trying to minimize people's interaction. So you park in the back, You come into the treatment room, you get treated, you go out the back, you call Diane and take payment and supplements, everything over the phone. At least for the next month. And then as we get more data, you know, as these numbers, we're getting data each month, then we adjust things. If the data is going the wrong way, you know, we'll go back to going back at home. If the data is stable, we'll kind of keep doing what we're doing. But we're trying to take extra precautions. We're trying to have less people in the building, less people in treatment rooms, more time in between patients, more cleaning, disinfecting. So we'll be at probably about, you know, probably half capacity for the next couple weeks. We're slow. I want to go a little bit slower for everybody's safety until we start to kind of get some data. But it is okay. The numbers do support. There's no guarantee, right? We can't, at this point, no one can guarantee anything, but the numbers and what we're seeing, despite what the media and all the BS out there says, the numbers are really improving and looking okay. People are still getting sick, but it's still that at-risk population. If you're at that at-risk population, I probably would not recommend coming in unless you really need to come in here. Stay at home.
Talk about that, because for the average person who's maybe not in that risk group as well, how do they know when it's time to go back? Something that they might be wondering is, what's serious enough that I can risk, in quotation marks, going into the office? Is it sleep issues? Is it pain? What is, you know, what would you say to someone who's weighing the risk of potentially getting the virus and going in to get treated for in your office?
Yeah, I think that's the hard part. I don't, no one can really give us a black and white answer on that. So I like to defer that to what people feel most comfortable with. You know, people are on, I like to give people choices. I'm very kind of independent thinker and prefer I give choices versus someone making choices for me. So there's people out there that, you know, they feel this is low risk and they want to totally get back to normal life. And there's people that are scared and have known people that have got this and are really scared and don't. So I think you have to figure out what's best for you, and there's no rush. I'm going to be here working, you know, as long as I enjoy it, which will probably be in the next 20 years. So if people want to, the nice thing is, as we start to release, get back safer at home, we let people more out, we can wait a few weeks and track the data and check in with the hospitals and see where cases are, you know. So hopefully then when that data comes back and people start to feel a little safer, then the people that are more timid then can start booking. So if you want to wait a couple weeks, that's what I want for you, and I prefer, you know. But if people are, I mean, I have people, they're really falling apart and they need some mental, emotional, physical support, then yeah, come on in. I think it's a risk versus benefit. The benefit to coming in and getting treated and processing all the stuff that's going on is more of a benefit than staying isolated.
And I think one of the best things people can do if they're dealing with that is to call you.
Yeah, exactly.
Flat out ask you your opinion.
Yep,
and
just call us and we can assess it. Yeah, but unfortunately, yeah, we can't, everybody's kind of got to make up their own mind. I can tell you what the government's allowed, and I can tell you we're taking all the extra steps and all the extra cleaning. And I can tell you, I feel safe because I think this virus has been here a lot longer. And I think a lot more people have been infected and have been asymptomatic. So I think we're doing okay. Obviously, if you have any fever or feel sick at all, stay home. You know, number one. Still, if you feel sick, just cancel, just stay home. And two, if you're in an at-risk population and don't feel fully optimum health, then it's probably best to stay home for another 2 to 3 weeks and see how this all shakes out.
Well, thanks for all the advice.
Yeah.
Next time we might have to ask you those questions of how long you think this has been around, but that'll just be people
We
coming
will.
back to watch next time.
Yeah, and there'll be some antibody testing. We'll have some testing available in the next week or two. I'm waiting a little bit to see how that all shakes out. So it's every week by week it's evolving. So we'll support everybody and keep everybody informed as best we can.
Sounds good. Thank you.
Yeah, have a good day. Bye bye.
Bye.